Hi, this is Dr. Neo, and today we are diving into a very important topic that affects millions worldwide: how diabetes impacts your eyes. Diabetes is a condition in which the body either doesn't produce enough insulin or can't effectively use the insulin it produces, leading to high blood sugar levels. These elevated levels can cause serious health complications, particularly in the eyes. The retina, which is the innermost layer at the back of your eyes, is equipped with special cells called photoreceptors that sense light and play a vital role in vision. And unfortunately, the retina is particularly susceptible to the effects of diabetes. High blood sugar can damage the blood vessels in the retina, leading to diabetic retinopathy, a major cause of blindness in adults. In diabetic retinopathy, damaged vessels can swell, leak, or even occlude, stopping the blood flow. And as the disease progresses, new abnormal blood vessels can grow on the retina, a condition known as proliferative diabetic retinopathy. You must be thinking now that if new vessels grow, then the problem is solved, right? But that's not the truth. These new blood vessels are fragile and lead to hemorrhages inside the eye, which may result in even worse vision or even blindness. Another serious condition that often accompanies diabetic retinopathy is diabetic macular edema, or DME for short. And this occurs when fluid accumulates inside the macula, which is the most central part of the retina responsible for detailed vision. And if you have this edema in your retina, then the vision is compromised. The onset and progression of diabetic retinopathy in individuals with diabetes can vary significantly, and it is influenced by the severity of diabetes and the duration of the disease. Nearly all individuals with type 1 diabetes will develop some form of diabetic retinopathy within 20 years of diagnosis, and more than 60% of type 2 diabetics will develop retinopathy within 20 years. Early detection is crucial for managing and treating this condition effectively, and being aware of the initial symptoms can significantly impact the outcomes. These symptoms may include blurred vision, floaters like tiny spots or lines that float in your field of vision, or even dark or empty areas in your vision. But you need to keep in mind that the early stages of diabetic retinopathy may not cause any symptoms at all, and there is a substantial research indicating that early detection and intervention in diabetic retinopathy can significantly improve outcomes. And here comes my part as an ophthalmologist to emphasize the importance of regular eye examinations for patients with diabetes. If you have to take something from this video, then remember that screening can prevent vision loss. So for type 1 diabetics, it's recommended to have an eye exam by an ophthalmologist or optometrist within 5 years of being diagnosed, and then annually thereafter. Type 2 diabetics should start with an eye exam as soon as possible as diabetes is diagnosed, and then continue with yearly exams. Again, screening is crucial because early detection and treatment can prevent severe complications. Moreover, effective diabetes management with your family doctor is essential. The pivotal diabetes control and complications trial and its follow-up study, the Epidemiology of Diabetes Interventions and Complications, have shown that intensive control of blood glucose levels can significantly reduce the onset and progression of diabetic retinopathy in patients with type 1 diabetes. Similar findings have been reported for type 2 diabetes in studies like the UK prospective diabetes studies, reinforcing the concept that early intervention, including lifestyle and medical management, can lower the risk and progression of diabetic retinopathy. Treatment options for diabetic eye complications may include medications, laser treatments, or surgery, depending on the severity of the condition. These treatments aim to stop the progression of the damage and reduce inflammation. One of the most significant advances in treating conditions like diabetic retinopathy and diabetic macular edema is anti-VEGF therapy. VEGF, or vascular endothelial growth factor, is a protein that promotes the growth of new abnormal blood vessels in the eyes. Anti-VEGF drugs, which are administered through injection directly into the eye work by blocking this protein that's preventing the formation of new blood vessels and reducing fluid leakage. This treatment has been revolutionary in managing and slowing the progression of diabetic retinopathy. Beyond medications, technology plays a pivotal role in the early detection and management of diabetic eye diseases. Advanced imaging technologies like the OCT, which stands for Optical Coherence Tomography, allow for detailed visualization of the retinal structure, enabling early detection of changes that might not yet be symptomatic. AI-driven tools are also becoming increasingly common in screening programs, capable of analyzing retinal images and identifying signs of diabetic retinopathy at early stages. These technological advancements are critical for timely intervention and essential for preventing severe vision loss. The landscape of diabetic eye care is continuously evolving, with ongoing research focused on developing more effective treatments and improving diagnostic techniques. For example, studies are now looking into biomarkers for earlier diagnosis and better targeted therapies that could offer new hope to patients with advanced diabetic eye conditions. If you have diabetes, it is essential to get your eyes checked at least once a year or more often if recommended by your eye doctor. So thank you for watching. Drop your questions and experiences in the comments below and stay healthy. Take care of your eyes.